Good evening, everybody. My name is Matthew Cook, and I am here to give you a presentation on why are RTs important for the healthcare team. Um, so I've been a respiratory therapist since 2012, and I've worked in uh, hospital, home care facility, and rehab facility since I graduated. That's just a little bit about me and my background. As far as knowing a little bit about the background information of respiratory therapy began in the probably early part of the 20th century and came about from advancements in technology such as oxygen therapy, aerosolized medications, and mechanical ventilation. These are just a few of the therapies that respiratory therapists manage, and they're still around today, even though they were part of the early 20th century technology. So, one of the best things that respiratory therapists can utilize as far as different forms of therapy and different assessment tools is just mostly patient assessment of the vitals. So you take the vital signs, your pulse ox, your heart rate, your respiratory rate, and being able to walk into a room and assess a patient is still very valuable, even though we do have all this technology. So as far as like being able to assess a patient, about 10 seconds is the amount of time that it should take you to be able to walk into a room and tell, is this patient respiratory rate fine? Is their heart rate fine? Do they need a rapid response team? Do they need a code called for the critical care specialist to get in there and put in an airway if they can't breathe, stuff like that. So that's one reason that we're pretty valuable, and it's also in part due because we're all over the hospital. We're in the emergency room, we are on the floors, just general patient care. We're in the ICUs, and that's a big part of what we do is just making sure that people can breathe. And as far as who can become a respiratory therapist, anybody that really wants to can become a respiratory therapist. And so far in my line of work, I've discovered that they come from all kinds of backgrounds. I have a friend who's used to be a UPS driver who went to respiratory school. It's a 2-year degree, and he's a really excellent therapist. I have a new friend I met who is a teacher, and she also became a respiratory therapist and is very knowledgeable, and then a counselor. So as you can tell, people come from all kinds of backgrounds to do this type of work, and typically one thing that they do one reason that they come to this field is because they have a family member who has needed respiratory services and can, I guess that was their motivation. It was just like the UPS driver. He had a daughter who was really sick. She was turning blue whenever he was at home with her. She was breathing 2 times a minute. He didn't know what any of that meant. So it was really motivating for him to go to school for respiratory just because of that situation. So we work in several different types of facilities. We have a hospital, rehab, and home care. And they're all different types of respiratory functions in the field, because in a hospital, that's a large facility. They have a lot of diverse responsibilities, and it's a tiered system. So you have entry-level therapists who are certified, and they usually stick with the more stable patients on the floor, giving breathing treatments with a nebulizer, such as some of that aerosolized medication, putting oxygen on patients, different masks, nasal cannulas, stuff like that. And every now and then maybe some BiPAP or non-invasive ventilation. But typically the entry level, they work with patients who are more stable. As far as the higher up, there's usually a registered respiratory therapist as an advanced level, and so they work with like your neonatal children who are born premature, on a ventilator, need oxygen, stuff like that. They also work in the ICU and within the pediatric areas, the places where you need to have a little more advanced skill set. So in the rehab, it's a lot smaller facility. A lot of times it's a long-term acute care or something like that, and the therapist there they don't really have the option of doing specialized work, because they're typically 1 or maybe 2 therapists per facility. So if there's a code, it's either just you or you and your partner go to the code. As far as other stuff, they do trach care and build patients with tracheostomies. They do EKGs, and they provide a lot of resources for the nurses, the speech therapists, and the doctors in that facility, because the doctor might not be totally aware of what vent setting would be the best to use for this patient's disease state, so, or how to do the trach care, what size trach tube they might need in the tracheostomy. So rehab can be kind of intense if you're new to it, but if you're a seasoned therapist, it shouldn't be too bad. As far as home care goes, that's a different type of therapy. Home care therapists provide education and they direct patients on how to use their equipment that the doctors prescribe them. So if you get a new nebulizer, they'll go over the medications, why you have the medication, how to use the machine, how to clean it, and make sure that it's being used properly. So if you have oxygen, it's the same thing. Go over oxygen tank safety, fire safety, stuff like that. But they also are very valuable because they can talk to the patient about their disease state. So if they have asthma, they can go over, what triggers your asthma and how to get rid of certain things in your home that provoke like an asthma attack, things like that. So, and medications, how to manage it. Same thing goes for COPD. You have chronic obstructive pulmonary disease, which is emphysema or chronic bronchitis. We kind of discuss that with the patient and talk about therapies, different breathing techniques to help prevent them from going to the emergency room. So, since I've worked all three areas, I feel like I can kind of diversify the information there and pick out what would be easiest to do. What I like the best was home care, but that's just me. As far as resources for respiratory therapists and patients, there are three big ones here. And you have the AARC, which is the American Association for Respiratory Care. And according to our book we have in school, which we call the Respiratory Bible, it's like this big. The AARC was founded in the mid-1900s as kind of a way to help promote respiratory care and promote patient safety and really try to get the educational side of respiratory out there. So they provide CEUs, continuing education units for everything that you can think of, from ventilator management all the way down to nebulizer management. So as far as the other resources, the NBRC, the National Board for Respiratory Care, is one that was founded in like the 1960s or so, and they are really the credentialing body. So if you go and take an exam, say become an advanced level practitioner, that would be the body that you would go to and go through to get your degree or to get a higher certification. Because those two are really the two primary for the respiratory therapists. Patients get a little information from the AARC, but not as much. But if a patient really wants to interact with a therapist online or has questions, they have the Facebook Association for Respiratory Therapists. And so that's a social media website where people can discuss like different topics that they have on, everything from two employees discussing different modes of therapy to a patient and a respiratory therapist discussing stuff, or even a physician on there. So that's all pretty good. But in conclusion, I think that respiratory therapists provide valuable resources to nurses, speech therapists, we work alongside them, patients and doctors as far as education goes.